Let me welcome you all. I'm delighted that you all were willing to take some time to hear Shelby's presentation and listen to the proposal that has been forthcoming. So first thing on the agenda is public comment, and this is public. Does anyone have any public comment for anything that is not on the agenda? All right. Hearing none, then let me just introduce Shelby. And by way of introduction, Shelby is going to cover all this, but let me just remind everyone that the initial affiliation between Sonoma Valley Hospital and UCSF happened in 2018. And so for the last 2 years, there's been a significant strategic collaboration with the first affiliation goals, I think, are either met or significantly underway. It seemed a good time, I think, to strengthen our strategic alignment via a management services agreement, a proposed management services agreement. So we've been spending some time over the past few months sort of finalizing, tweaking the proposal. And I'm delighted to introduce Shelby DaCosta to present it to all of you this evening. A little bit of background on Shelby. She's the Senior Vice President and Chief Strategy Officer at UCSF Health and is the President of the UCSF Health Affiliates Network. There are a number of other facilities that are also affiliated with UCSF. In that role, she is responsible for leading and executing strategic planning and business development for UCSF Health. She oversees relationship and network development for the health system, as well as concierge and executive health, managed care, marketing, and branding. And during COVID times, there was a lot of other duties as assigned, I must say. As president of the Affiliates Network, she's responsible for executing each contract, managing the relationships, and ensuring their successful operational alignment with UCSF Health strategic priorities. She's been with UCSF Health for 5 years. She previously was Senior Vice President of Mergers, Acquisitions, and Partnerships at Trinity Health in Michigan. And she's had various planning roles at Dignity Health, both in San Francisco and Nevada, and with Kaiser, with the Permanente Medical Group in Southern California. So she has a strong background. She's been a wonderful colleague to date, and I'm delighted to introduce her to you to do the presentation this evening. Shelby, welcome.
Thank you so much, Jane, and thank you to the Sonoma Valley Healthcare District Board, to the community members, and I even see a board member, Mr. Sandy Weil. So thank you to Sandy and to everyone for joining us tonight, and thank you so much for really welcoming UCSF into your community. It seems like it was just yesterday that we were having a very similar conversation about an initial collaboration. And boy, does time fly. It's great to have a moment to reflect on what we intended to accomplish, what we did accomplish, and all the grand ideas that we have for our collective future together. I know it's late, so I'm going to try and keep this to really 4 key topics for discussion. One, just a little bit of background about UCSF Health. I think many of you know us very well, but we have evolved over the last few years, and I thought I'd give an update not just on who we are today, but also the network that we've grown, of which Sonoma Valley Hospital is a critical member of. I'll reflect a little bit, as Jane did, on our vision, what we set out to accomplish in 2018, and then talk about what we have done, largely through hard work from the Sonoma Valley Hospital management team. I think they might be on here: Kelly Mather, Sabrina Kidd, and Ken Jensen, along with UCSF colleagues, and significant support from the board. And then I'll talk a little bit about what we've been doing just recently through COVID, which has been fantastic for both institutions in a very tough time for, I think, Sonoma, for the Bay Area, for really the world. And then I'll end with the proposal for expanding our affiliation to take advantage of what is pretty great momentum and a strong relationship, and certainly from a UCSF Health standpoint, a level of comfort around our ability to really grow our mission and our vision, and we think really support yours as well. So let me just jump in. I talked about mission, and I think it's important just to always share our mission. I know you have a similar one. It is for UCSF, caring, healing, teaching, and discovering. And that is the why we exist and why we do everything, including grow our network so that we can continue to support this very important mission. Our vision is to be the best provider of healthcare services, the best place to work, and the best environment for teaching and research. And we hold ourselves to a very high standard. I'll note here some of our rankings, and whenever it is that we are not number one, we're completely disappointed. And we know that Sonoma Valley Hospital has the same aspiration for excellence, and it's something that I think drives both of us in the work that we do. And then in terms of how we make decisions, our values spell pride. They're professionalism, respect, integrity, diversity, and excellence. This is the way in which we also select our partners. And I think you all really live the pride values every day. And when we have tough decisions, which we often do in partnerships, we reflect back on these values to make the right choice for the collective good. Just a few stats here. I talked about rankings and I talked about excellence. It wouldn't be a UCSF presentation if I didn't talk about US News, which is how we rate ourselves compared to other academic medical centers. Today, we're the #1 hospital in Northern California, in the top 10 nationally at number 8, and working really hard to get even further to the top for next year. We have about 1,300 licensed beds across 4 hospitals, 3 in San Francisco and 1 in Oakland. Our children's hospital is in Oakland. Important to note for us, because this drives our strategy, there are many days at which we are completely full. And that is part of the reason why we need to grow, and we need to work with partners outside of San Francisco and outside of Oakland to help us take care of patients who are really struggling to get in to see us. In terms of size, we're about $5 billion in revenue, and we have about 3,000 physicians and 12,000 employees. Also important, and a significant area of growth for us over these last 5 years, where we've doubled from about 1 million outpatient visits a year to 2 million, this is where we see a significant area of growth, not just for ourselves, but for the network of which Sonoma Valley Hospital is a part of. And I know there's been some investments in Sonoma that'll help us achieve those goals. When we talked in 2018, we were just on the beginning of our journey towards really building this network. And what we've done over the last few years is really, in every county, selected hospitals that shared the same vision for the future and the same desire to help take care of our patients in locations that were closer to home and with support from an academic medical center. In many cases, it's our employees and it's our physicians that also live in these communities, and it's critically important to each of our team members that we are really elevating care and that we're learning from what other hospitals and physicians do very well that we can also adopt at UCSF. So on the left here, I have the network of hospitals that have become the UCSF Health Affiliates Network, either through Canopy Health, which is our accountable care network, or through a more direct relationship like we have with Sonoma Valley Hospital. There are 4 hospitals that we have such a significant collaboration with. It's Sonoma Valley Hospital, Marin Health, and John Muir Health, as well as Washington Hospital and Healthcare System. Those are the 4 health systems and hospitals that we've really separately developed dedicated relationships with. And then on the right, we separated these just because there's so many circles here, but you'll see that we've also grown our reach. both on our own with extending specialty clinics throughout the 9-county Bay Area. We have many rotating faculty, but we've also worked to develop strong relationships with both large groups, like an example being the Marin Health Medical Network physicians, the nearly 200 providers today, to primary care providers like we have in Berkeley that are a part of John Muir Medical Group. Many of these partners remain independent, as do our hospital partners, and we think that's important and a good feature for UCSF Health in terms of being able to bring the best of UCSF and attaching it to a strong independent chassis. We also have affiliations with other institutions like Hospice by the Bay in the post-acute space, urgent cares, and more recently, digital healthcare companies like Circle Medical in San Francisco that are fully telehealth providers. I pulled this slide because I remember talking about it in 2018, and I just thought it would be good again. We chose each other to affiliate with, but from a UCSF standpoint, it was again because we believe that there were shared values between Sonoma Valley Hospital and UCSF. The Sonoma Valley Hospital executive team had signed up to be a part of Canopy Health, which is really designed to create a new experience with more flexibility for HMO patients throughout the 9-county Bay Area. And we were really impressed with the culture of quality and safety and the outcomes that Sonoma Valley Hospital, even as a small hospital, had achieved. And in fact, I think Sonoma Valley Hospital was already using our scorecard and using the same measures as UCSF. So we didn't even have to turn that on. It was done, and there were great achievements already. We knew that the hospital had a strong brand name, a lot of loyalty. We also knew from discussions with other partners and healthcare providers that the hospital had a good track record of collaboration with many different kinds of providers. And we had a leadership team and a board who was very open to this idea of partnership. So in 2018, we developed this joint vision to guide our affiliation, and it was, again, very simple. It was about us sharing best practices and collaborating to enhance quality in the Sonoma community. We had a goal of coordinating services so that if someone from the community had to get to UCSF, that we would make that transport easier. It's often not easy to get patients to another hospital that's far away. We also wanted to make it easy to get back home when there no longer was a need for UCSF specific support. We knew that there was a need to support the really excellent physicians that were already in Sonoma Valley Hospital, and we'd heard about a need to extend things like our electronic medical record, which we've begun to do as of 2019. And then, kind of culminating in all of these specific initiatives was the goal to increase patient, family, and community satisfaction with healthcare overall in the community. And I mentioned this earlier, but thanks to a really great leadership team in Sonoma, we were able to quickly do things that we needed to do, like appoint a medical director over the relationship, which was required when we use our brand and extend our name to Sonoma, which we did. And we went through a rigorous interview process and identified Dr. Sabrina Kidd, who's been just exceptional to work with. We deployed some telehealth capabilities, neurology to support the ED. And in fact, I think the day that this went live, there was a stroke patient who presented to the Sonoma Valley Hospital emergency department that was able to stay locally for care with support from the UCSF Department of Neurology, which was absolutely the goal for this relationship. We also earlier this year turned on our infectious disease telehealth support, which was very timely, and no one could have predicted how important infectious disease support was going to be, but we were glad to have that relationship. And then this month, we'll be deploying a teleurology clinic where Dr. Peter Carroll, our former chair of urology at UCSF, will start seeing patients over the internet in a telehealth fashion, but there will be notes in the system that will allow Dr. Carroll to refer patients locally to Sonoma Valley Hospital for any tests or imaging or other services that need to be provided. And all of that can be done locally while still connecting patients to UCSF specialists. So that is a model that we're extremely excited about. We intend for this to be a pilot. And our goal is that we can assess just exactly what the demand will be for some of these services and then come back with a plan for a physical space, which we know is really important, that supplements what are, I think, great physician clinics already in place, some of which we are also affiliated with, and some of which are led by independent physicians who we also know are of high quality. And we're really excited to work side by side with the community physicians to provide care. And we know that there's capital expenses involved, and we're willing to contribute once we know to building out facilities at the Sonoma Valley campus as well. We've also worked very well together in elevating quality, whether that's through the Stroke Ready certification or 5-star hospital quality readiness. I mentioned the clinics, and in addition to deploying the UCSF Health electronic medical record for a subset of physicians, which was a great learning experience for us, we're also able, through our affiliation, to reduce a subsidy for the hospital to support these services by about $500,000 annually, which we know was a big help to the bottom line and difficult for all hospitals to maintain what are growing expenses amidst pressured revenues. And then we're really excited about the co-brand of UCSF Health and Sonoma Valley Hospital. It just kind of cements the relationship that we have and should be a message to the community about the support that UCSF is providing for Sonoma. I won't spend a ton of time on what we've done together through COVID, but I will just say that it has been significant. And what we realized was that there was huge value early on in getting leadership together from across our network facilities and partners, including two of our most regular participants, the CEO, Kelly Mather, and CMO, Sabrina Kidd from Sonoma Valley, on these calls, sometimes multiple times a week, where we could share best practices with leadership from Marin Health and John Muir Health and UCSF Health. We were able to share our guidelines and our protocols on an ongoing basis. And through very generous donors at UCSF Health, we were also able to share personal protective equipment with many of our affiliates, including Sonoma, at a time when there were severe shortages. The same goes for testing. Testing was an evolving practice, and we were able to collaborate on testing best practices. And today, it is possible for Sonoma patients to get their COVID testing at Sonoma, should they need it for a preoperative procedure or any sort of procedure at UCSF that requires COVID testing. It can be done locally. And lastly, we were able to deploy some really cool technology that really was able to help many of our affiliates. But one example I would highlight is a group called Elemento Health that works with UCSF today to provide mobile technology that really brings to frontline providers updated training and protocols, and does so on a real-time basis. That was especially critical during COVID, where many of our policies were changing sometimes daily. And we were able to extend this platform with all of UCSF's protocols to Sonoma Valley Hospital in the early stages of the pandemic, literally over a weekend, so that the emergency staff at Sonoma were able to take advantage of UCSF's training modules as well. I think that's a great example of just being able to very quickly support each other during a time like COVID. So then looking ahead, we know that there's a really great strategic plan that's been developed for Sonoma Valley Hospital. And it's based on continuing to exceed expectations in what we know is an important community resource, the emergency department, becoming the 5-star hospital, continuing to provide access to excellent physicians. And then, as I mentioned earlier, really growing the presence of UCSF Health in a way that's complementary to what is already provided in the community. And we have looked at potentially utilizing a previous space that was the ED as a location for a UCSF clinic in the future. At the same time that Sonoma Valley Hospital refreshed its strategic plan, UCSF Health did as well. And there's 3 components to our strategic plan for the next 5 years. This just went live in July for implementation with 3 goals. One is to be the Bay Area leader for complex care. And we've made some significant strides in growth and market share. And our goal is to really grow the areas of services that are critical to our mission. Many of them only provided at academic medical centers and really grounded in services like neurosurgery, neurology, heart and vascular services, cancer, and pediatrics. And the second piece of our strategy is really taking advantage of this network that we have, this network that Sonoma Valley Hospital is a part of. And our goal here is to ensure that no one needs to drive more than 20 miles to access UCSF care. And that means that we will have to deliberately build with our partners more services in each of these communities in order to achieve that vision. We also know that there are some very intentional strategies for programs that are important to our partners, important to UCSF Health. Urology was a great example of where we thought we could work together to increase access to services. And I think there are other examples in surgery, in endocrinology, where there may be other opportunities for us to work together to build destination programs. And then lastly, we know there's always a need for primary care physicians as well. We work very closely with Marin Health Medical Network, who supports Sonoma Valley Hospital. And we also have multiple models that we could deploy to engage and support recruitment for primary care doctors. The last part of our vision is innovation at scale. There's tons of different really great inventions and capabilities that we have within UCSF. We haven't brought them all out to our network, and we definitely haven't scaled them, and that is something that we're excited to do with a new team that is spread across the Bay. In order to achieve this Vision 2025 for UCSF, we reorganized our management team. This happened earlier this year, into what are 6 functional area leads. And these are the typical functional leads: operations, clinical, finance, strategy, human resources, and IT. And then we also organized our businesses into 6 divisions. And what I would call out here is, in addition to our faculty practice, cancer service line, behavioral health entity, adult and children's, there's a new entity called the Affiliates Network. And that signifies the importance of the affiliates moving forward for UCSF in terms of being able to deliver on our mission. Our proposal is to build out that affiliates entity. I'm the president of this network. I'm extremely excited about leading our team, and there are other members of the UCSF Health affiliates team that have since been recruited to help us achieve our vision. As it relates to Sonoma Valley Hospital, what we're proposing is that the CEO, the CMO, and the CFO are also part of this affiliates network through a management services contract, which would mean that the Sonoma Valley board would have a relationship with UCSF to hire these 3 positions, and we would pass through the salary and benefits expenses back to the board. And what that effectively does is bring these 3 leaders much closer to the UCSF Health team and makes it easier to deploy the resources that are available here at UCSF. As we've discussed this with the board and with the executive team, we think there's a lot of reasons why this makes sense. I'll highlight a few. One is the integration that I mentioned. As we are organizing ourselves to really be active and deliberate in the network, it is helpful to have a single team that has a single vision. We believe having this executive team employed by UCSF means that we will be able to extend the catchment area for Sonoma Valley Hospital, and we think the reach with the brand that we already have established will be strong. We know that there are some opportunities for growth in business. Sonoma Valley Hospital's team has already worked very closely with the community to extend services and diagnostics. We believe with the support of some of our UCSF Health specialists and programs that we'll be able to further utilize that equipment and that space, and that there may be other opportunities for therapies to be provided at Sonoma Valley Hospital. And that's what this team can work on together. This team can also provide a voice at the broader UCSF Health management discussions, noting what the needs are in Sonoma Valley Hospital and driving some of the decisions that we make here. And it is also just simply easier if we have this team as employees for them to go into our systems and pull best practices and have access to training and tools that can in turn be shared. We also believe there's great development opportunities, not just for the executive team as they are a part of UCSF, but also vice versa, that there may be learning opportunities for other UCSF Health employees to work and support Sonoma Valley Hospital. We know that we're in the process of recruiting a new CEO to replace Kelly Mather, and we think that a relationship like this will provide some stability for the CEO who will be looking at a really tough situation of being an independent hospital. And I think there's fewer and fewer independent hospitals across the country. In the North Bay, I know there have been some recent affiliations. This is a nice balance of having an affiliation while still maintaining the independence of a hospital. And for the Sonoma Valley Healthcare District Board, I think taking this next step with UCSF provides more long-term risk mitigation. You know that there's a partner who knows you and understands you and has been working with you for a few years now and for more years as we're requesting to really understand and navigate what is a difficult operating environment. So in closing, I would just like to say a few things. One, just like in 2018, this partnership is a high priority for UCSF Health. Partnership is what we do, and we believe in really bringing the best of UCSF into the communities and also learning from you and taking that back to our academic medical center. Sonoma Valley Hospital is emblematic of the other hospitals and entities that we've partnered with, in that you're very strong, you're independent, and that you believe that working together will strengthen our future. So I'll pause there and maybe turn it back to Jane.
Thank you, Shelby. Very thorough as always. Now we would welcome questions, comments, thoughts from members of the community that have logged on to the call. So I know there's a few of you, but maybe if you have a comment, you could make sure that you unmute yourself and maybe raise your hand so that I can call on you. And our regulations are that you have about 3 minutes to present your thoughts or your or your question. So. Anyone? No questions? No comments?
Hi, this is Liliana. Can you hear me?
We can hear you. We can't see you.
Oh, that's right. Sorry. Here I am. So my name is Liliana. Great to, and thank you for this presentation. I'm a retired UCSF employee, and I go to UCSF for my medical care. I live here in Sonoma, but I always go there for my care. So in the future, I might have missed this part. Is there a way of connecting with Sonoma Valley Health, connecting to my UCSF medical records? Will that be a possibility down the road if I decide to do more of my care here in town?
It's certainly a possibility for the future and a high priority from both UCSF and the Sonoma Valley Hospital's leadership teams. Right now, we have some connectivity through a number of clinics that are affiliated with Marin Health. And I think we've learned how to extend our instance. It is still an expensive proposition to install an electronic medical record. So that initiative probably goes along with some of the growth initiatives that we have discussed as well.
Okay, great. Thank you.
Meg.
Well, I want to commend Jane and Shelby for pursuing this. It's very exciting possibilities here. And there's a number of details that I have questions about, but maybe I can put those in writing at some point or some suggestions. One thing is the revenue flow back and forth. Of course, there's a lot of details there that you're trying to structure correctly to be mutually beneficial. One thing I read, for example, was that strategic planning and marketing, Sonoma would pay for those. But I'm thinking that those can be mutually beneficial, so to UCSF as well as to Sonoma. So I wasn't sure why the revenue would flow that way, for example. And then there's a sentence that I read that said, you may refer diagnostic work. So I'm sure there's more detail that you've thought about there and what the may means, or is it will, and in some cases. So those are a few of my comments or questions.
Thank you, Meg. Maybe I could try to answer them briefly. First, on the marketing, it absolutely is beneficial. And what we've seen is that we can effectively partner together to share in advertising costs that have really broad impact. An example was when we were welcoming patients back to the hospitals after each of us had, as individual entities, gone through our preparation and felt like we could start having patients return. We did a broad campaign, and the cost to Sonoma Valley Hospital was extremely low because UCSF subsidized the majority of that advertising. But it was also low for us because we were able to spread it over about 6 different providers. And so that was a win-win. Where I think there's some contribution from Sonoma as an example with dollars flowing to those costs, but significantly lower than if the hospital was to try and do it on their own. And then maybe to the diagnostics question, absolutely it'll be, physician driven in terms of what can or cannot be provided. Our goal is that we'll enhance the capabilities that are already there. And if there are things we need to do to make it more accessible or to grow our program so that there is more utilization, that's absolutely something that we're interested in discussing. And I think we'll learn a lot from our urology telehealth program that will inform our future models.
And just one other question. Is this open-ended or is it a 5-year agreement?
Good question.
Yeah, I think as we've discussed it to date is that we would have an additional 5 years on top of the remaining, I think it's either between 2 and 3 years that we have on our current collaboration.
Yeah, it would be an additional 5 years from the date of approval moving forward, right? Donna, hi. Can you unmute? Unmute yourself. There you go.
Hi, thank you. I have a lot of experience with both organizations, and I'm, basically very in favor of this. I think it sounds fabulous for Sonoma Valley Hospital. But I do have one question, and that is, I have gotten taken up at times in the bureaucracy of UCSF, the difficulty in making decisions, the distance between UCSF management and patients or even doctors. And thank God for the doctors. We are so lucky to have them being brought closer to Sonoma Valley Hospital. But we are, as a community hospital, going to lose a lot of control. And it concerns me only because I have the experience in living with this in the city with UCSF, where it's pretty tough. So if anyone wants to comment on that, I would appreciate it. Thank you.
Sure, maybe I'll start, and then I'm not sure if any of the physicians might want to comment as well. That is absolutely true, Donna. It could be, in some cases, very easy to get from, one site to another, or have care coordinated with one physician to another, and it could be very difficult. And the same is true across departments at UCSF Health. And that is part of the reason why we want to have this management team that works so closely with the UCSF Health's new affiliates division, so that we can solve for this. And it will not happen overnight. It is difficult. But with a dedicated team, as opposed to asking many different organizational leaders who are fantastic to do this in addition to their day jobs, our goal is to really make that experience front and center for this group. And that's, I think, driving this, and everything you shared has been shared. And I think we're taking each one of those comments and figuring out how we fix that.
Thank you.
Lucy.
Hi, I think this sounds very exciting, but I do have questions about how actually the CEO would be picked, because I thought we already had a search firm looking. Can you hear me?
Yeah, you sure can.
Yeah. Okay, good. I thought we were already paying for a search firm. And we all know that CEO here has to really blend well into the community. We're going to have the issue of parcel tax in a couple of years. I don't know what UCSF's thought is in terms of helping us in that way at all. So just sort of how the board and our search firm and UCSF would be picking the CEO, and if the community has any input. Also probably just the costs with the management contract, and would it be much more expensive than if we hired the 3 people ourselves? And I guess the third thought is just, I think it's great to have an outpatient center, but I just want to make sure that, down the line, the hospital still stays as a hospital, and we don't just become an outpatient center for UCSF. Those are my concerns, questions, whatever. Thank you.
Joshua, do you want to talk a little about the search process?
So great question about the search, and UCSF has been with us as part of our ongoing affiliation in this process to select a new CEO since day one. Shelby actually participates as a member of the search committee. She was helpful along with folks from UCSF in supporting the search committee in its selection of Witt Kiefer. We actually have both our core representatives from Witt Kiefer, that's the search firm, on this call right now. And I would expect that both Shelby and Mark Laird, who's the CEO and president, will be involved in a final decision on a CEO, although that final decision will still rest with the board of the Sonoma Valley Healthcare District. So they've been extremely helpful. They have been both helped us from a process perspective, from a technical support perspective, from a good wisdom and help perspective, but the decision will finally rest with the board. That was the first of your questions. I think there was a question about the outpatient center and about the cost. You want me to address the cost, Jane, or do you want to?
Go ahead.
So, you know, the agreement that we're proposing with UCSF would be on a pass-through basis. And so there's no way we'll know exactly what the total cost of the 3 executives will be until we hire a CEO. The salaries for both Sabrina and for our CFO, Ken Jensen, there's no proposal to change them as we transition to this. And because there's no markup, there isn't a difference in the salaries. UCSF has a different benefit structure, which will add a little bit to the costs of those. And the total package, again, will depend on what the salary for the CEO is. We believe that, and I think our search firm partners believe, that because of this relationship, it's very possible we will be able to recruit somebody at a slightly lower cost than we would if we were independently doing that. And of course, the benefits that are a little bit higher would be looked at by any candidate as they would look at the total package of what their comp would be. So I think we might, you know, if you ask for my opinion, it'll be a little bit more expensive, but I don't think we'll know until we actually hire a CEO.
And I would add that I think we are looking, of course, to increase revenues as well as determine some economies of scale. Witness the $500,000 that has already been saved as the Prima subsidy. We have talked about the possibility of perhaps being able to take advantage of some of the group purchasing structures that UCSF has in place, and that in addition to what we hope will be some increased volume and revenue as a result of outpatient activity, that it'll be a wash. There's another probability, I think, of UCSF purchasing, if you will, part of the CEO's time to work on mutually agreed upon projects, which would mitigate some of the overage as well. And just to speak to your comment, Lucy, about it remaining a hospital, I think now more than ever, it's very clear that a hospital is needed. This pandemic has shown us how important it is to have hospital beds, critical care beds, and the capability to care for patients as close to home as possible if it's safe for the patients to be there. So I personally don't see any chance of it becoming just an outpatient facility anytime soon.
Can I just add a sentence to that? I think that the rationale for this affiliation strengthening is exactly the opposite, right? UCSF, unlike many other potential, somebody doesn't like that. Unlike many other potential partners, UCSF is not looking to take our inpatient volume or even our outpatient volume back to their facilities, just the opposite. They're actually looking for ways to leverage what we have, which is a lower cost facility closer to the community with high quality care to help them with a capacity issue that they're not able to solve on their own. And so my view of this is it's going to increase the volumes both through our diagnostic and those types of things, and also our surgical center, and I suspect in inpatient over time also, as opposed to the other way around.
Steve?
Could first I think Meg and Donna asked worthwhile questions. They're important. But as somebody who's been a UCSF patient probably from about 1972, I really commend the board, Kelly. I think Sandy Weil played a role in this. I think we're blessed to have this relationship, and I think it will keep more people in the Valley. One of the members of the study team that I was a part of early last year had a wife who had a stroke about a week and a half ago, went to the hospital, went to UCSF, is back, and she's fine. So I think this is a marvelous resource for the Valley, and I commend all of you who made it happen.
Great. Thank you, Steve, for that comment. Yeah. Any other comments? If there are none.
No,
may-
Susan Crutchfield had a comment. She's not unmuted, though.
Oh, I can't. Hi, Susan, can you unmute yourself?
Susan, did you want
There
to
you
say
go.
something?
There you go.
I just wanted to answer one thing about the medical records. I've been going to UCSF and do the primary care in San Francisco. And then when it came here on First Street West, I've been going there, and they had me do a bone scan last week, which I did at the hospital. And it's the first time I'd been to Sonoma Valley Hospital, and they were so amazing. Anyway, to answer her question, the results came back right on my medical record with UCSF a few days later. So they do use your medical records that you have at UCSF. The not only Sonoma Valley Hospital, but also the UCSF clinic. And the other thing is that I just want to say I completely support the enhancement of the partnership. And I think that it's a huge credit to UCSF and vice versa.
Thank you, Susan. Appreciate your comments. Are there any comments from my fellow board members? Bill, Sharon, Michael, Joshua, anything further?
Yeah, I was very positive on this entire development, as I was on the original affiliation agreement. And fortunately, as this was developing, we had two very good representatives meeting actively with UCSF, and that was Jane, of course, and Joshua, over several months, talking to them and expressing what our needs and interests were. And then Shelby really came back with a wonderful proposal. The only part of it that I was somewhat of a skeptic about was the arrangement that the three top officers would be employees, of UCSF. No problem with the financial pass-through or with the slight, perhaps, increase in cost associated. But she, as we had a meeting with her, she explained that very well, and it's very beneficial to us that they are employees of the UCSF system and able to access resources from what will be their colleagues at UCSF. So that was my only point of, you might say, receptive skepticism. So the board will be, as Jane is indicating, will be considering this officially as an amendment on November the 5th, that Thursday night.
At our next board meeting, that's correct. I would just like to add, I want to make it clear that the reporting relationship remains a direct line to the Sonoma Valley Board of Directors. There's a dotted line relationship to Shelby and to the affiliates group, but the Sonoma Valley Hospital Board of Directors does maintain the direct line reporting relationship to the CEO. And then the CMO and the CFO will continue to report directly to the CEO with a dotted line to their counterparts in the affiliates, in the UCSF affiliates network. So it provides the opportunity to really take advantage of resources, to have a direct line of communication, but still maintain direct responsibility here locally, which we think is very important. Sharon, Michael, anything? All right, if there are no further comments or questions, I want to thank you all again for your questions, your comments, Shelby, thank you, of course, for the wonderful and thorough presentation. And as Bill indicated, this will come up for further discussion and potential approval at our November 5th board meeting, which is the next upcoming board meeting. So thank you all. Appreciate your presence. Lovely to see you, and I'm so glad you took the time to be with us. And I will adjourn the meeting.